Welcome. I have to tell you, right off, I tried your new cream, and this is so not because of the moment and that we're speaking together. I just fell in love with it. I think it is so beautiful.
Thank you.
And I'm thrilled that you're here because I want to learn more and more about it. So, first of all, tell me about yourself. Introduce yourself to my audience.
I am an oculoplastic surgeon. I'm board certified in the US, which means and here in the UK. So that means that I focus surgery on the upper third of the face. So I do eye lifts, eyebrow lifts. I do anything that has to do with the eye, reconstructive or cosmetic. And I moved to London many years ago in 2006 for love. Didn't know if I was going to be able to work here. It was actually quite, traumatic a little bit. And found a way to become the equivalent of board certified here. It took a couple of years to do. I did an extra fellowship two fellowships during that time in plastic and reconstructive surgery. And that's when my industry was really changing a lot. And it was super fun here. I was in the NHS working with fillers, which I didn't have really access to in the US at the time. There was only a handful in America and it was not mainstream at all. Botox had not even been FDA cleared at that point. And so, or just got FDA cleared. And so I think for me, it was just learning how to use all of these things. And I thought, wow, there's so much you can do before needing surgery because I, like most surgeons, love to operate. But that showed me that, someone who'd had maybe 15, 20 surgeries for a skin cancer or trauma.
Right.
And they said, I just don't want to have another surgery. Is there anything else you can do? Right. And so we were using injectables. We were using lasers. I thought, wow, this is amazing. There's so much more you can do. And that kind of took me, I don't want to say on a different path. It's just every part of my life has sort of opened a different door that maybe wasn't mainstream for what I do in my profession, but super interesting and, has brought me to where I am now. So I've been working here for a long time. I have a private practice and I started MZ Skin in 2016. I actually started it for myself. I was suffering from really bad pigmentation after my daughter's birth. I had something called melasma and I went from having like clear, beautiful skin to having patches of pigmentation that really made me feel like I looked dirty and I don't wear a lot of makeup. And so it was I just felt like I wanted to scrub my face clean. And at that time, I love skincare, always did. I was using all the expensive, brands that we all know and love. But I decided to go down the doctor route. Some of the doctor brands were starting to pop up. And I thought, you know what? I want something that has a little bit more punch, even if it doesn't feel as nice. So I started using some doctor-led brands. They were all made by men. Mm-hmm. And I lost that sense of enjoying the ritual aspect of skincare because no matter what I did throughout my life from the age of 14, the last thing I did when I came home was wash my face and put on some nice creams. Mm-hmm. And if it was even a t-shirt and boxers, it didn't matter.
Yeah.
That was my nighttime ritual. And to this day, I sleep really well. So I feel like that has always been part of my self-care. And I lost that and I became the non-compliant patient. And so I started mixing for myself. My husband's like, oh my God, there's so much stuff in the bathroom. And he said, why don't you just combine them? And I did. And that's where MZ Skin was born. A junior buyer at Harrods wanted to launch me. She said, we only have one other female-led doctor brand in this space. And I want to launch you in 6 months. And I said, but I don't have a brand. She said, well, get it going. And 6 months later, like Cinderella, I walked into Harrods.
Amazing. That's a great story. It's really fantastic. It actually is very connected to where I'm at right now, thinking about I want to do something. Turning 80.
Amazing.
I feel like maybe it's time for a facelift. I'm not sure. So I've been doing a lot of research and then it brought me back, long story short, to, well, maybe there are some things that I should do first before I go straight there.
Into surgery?
And yeah.
I think there's different routes. So skincare, of course, is the cornerstone of everything. And also the way you live. I mean, you look, and I know, you don't drink, you have a healthy lifestyle. You're slender. You've been slender your whole life. I think that's actually maintenance of body mass, body weight, exercise, sleeping, all of those things are like, all of those things play a really big role. But I think in face, size matters, and the yo-yo dieting type of things. I think those individuals tend to see more laxity of skin because just from the sheer fact that they've changed size and then gone back, shrunk and gotten bigger, shrunk and gotten bigger. Of course, lifestyle choices, drinking, smoking, drugs, all of those things. But I think skincare is the cornerstone, in conjunction with good living, and now we're all about living our best lives for as long as possible. We all want to live well as for as long as possible. And we want to look well while we're doing it. We want it to be there needs to be a match. So I think there's no stigma, fortunately, now with having surgery, and you do whatever makes you happy. If you want to do that, then you go find the best person for yourself, and, great, good for you. And if you don't, that's okay too. There are other things that you can do. Nothing takes the place of surgery, but surgery is for, moving, skin. If you have lots of skin, there's only so much we can do non-surgically, but there's a lot of things, and you have beautiful skin. It doesn't look like you've, sat underneath the sun with olive oil on your skin.
No, just drinking the olive oil.
Well, that's great.
So tell me a little bit about your background. First of all, the being a surgeon and making a commitment to that is really a big decision. So what made you choose that path early on?
I knew I wanted to be a surgeon. So
you did.
I did. So I didn't know I wanted to be a doctor. I come from a family of my mother and my father are both doctors. And I'm the eldest of four of a Middle Eastern family. So it was predestined for me slightly. And I really didn't like my first 2 years of medical school, to be fair. And then I started surgery rotations and I just fell in love. Loved being in the operating room. I loved the idea of going in, having a problem, fixing that problem and coming out, and then that person waking up and being like, thank you, I'm better, so obviously that's a very, a niche sort of area, but I loved the ability to make people feel better and happier in a short period of time. It still gives me so much satisfaction. And I didn't know what I wanted to do in surgery, but I worked with an organization called Operation Smile when I was in medical school. I was really fortunate. One of the founders' son-in-law was a medical student there. And so he was raising money, and we would do bike races and raise money. And I raised the most amount of money that one year, and they offered to take me to Thailand on a mission. And I was a volunteer with, I think there was like 12 doctors. There was about 40 of us all together, doctors, nurses, and just people who were helping in terms of, organizing everything. It was incredible. It was some moment in my life that I think was pivotal because I saw people, they walked for days to come to see us. They obviously didn't speak English. They had crazy cleft lips, palates, some of them even burns that we were able to organize to send, to the UK or the US or, different places. Johnson & Johnson had sponsored it. So we had all the equipment. The doctors would, train all the other doctors there. So not only did they help about, 150 kids, they also trained the doctors that were there how to repair these issues and then left a bunch of supplies behind. And I was just in awe of these doctors and their ability to, really change the life of the people who they helped. And also they all volunteered. This is a 2.5 week operation. It was a big deal. There was a lot going on. And so when I came back, I knew I wanted to do something where I would make an impact. And I also wanted to be really good at it. And so I wanted to be a specialist. And so when I decided what I was doing, I wanted to be very niche. And I looked at different things. I looked at plastics. I looked at ENT, ear, nose, throat. And I looked at ophtho. And I loved ophtho because it was so precise and so neat and so delicate. And yes. And so, even now, every time I do surgery, which is, every Tuesday and Friday, I'm like, this is so fun.
So you're not just the skin
No,
queen.
no.
You are like, you're in it. Oh, that's so great.
I love it. It really gives me so much satisfaction. But, every time I make, the eyelid incision and sewing it up, it really makes me happy to see how pretty it looks at the very end.
Yeah.
And, it just gives me a sense of satisfaction. So I feel
That's
very
amazing.
fortunate.
That's so great. I mean, when you love your job, there's nothing better.
I feel bad for the people who don't, because actually I spend so much time at work and with the people who I work with and the people who I see as my patients and, my team for MZ Skin, that if I didn't like what I did, it would really be heavy.
Yeah.
And life's too short.
So going into this career, this is a major step, and it sort of defines so much of who you're going to be for the rest of your life. And so in the idea of physically having the power to change the way somebody feels or looks is incredible. I've learned through the years that a dress can make somebody feel good, but I always thought, I'm not curing cancer here. But you're really doing.
But you're making people feel so happy.
But it's
you give them self-confidence.
Yeah, but yes. But I think what you're doing is even a magnified version of that, where that's so much. You take off your dress, you take off, your makeup, you do whatever, then there's you. And I think for women, and you know this, all women know this, that how we look is primarily the way we're judged first. Even you're a surgeon, no matter how long I've been in business, it's still going to be the way women are judged. And so what you do is actually really closer to that.
Well, we all add to our little different ways, but
I think it's fantastic, and it's so brave too, because you really have to be good at it. You have to be good at it all the time, and there must be something you put in your head. So when you're going into surgery or you're going into a challenge like that, you said you sleep well, which is helpful.
Yes,
I'm sure everybody's thankful that you sleep well. But what do you think about? Like, what's your mindset? How do you frame that?
So actually, I think of it as if, you're training for something long term. So I always sleep early the night before surgery. The last thing I do is I work out, I take a shower, and I go to bed. And then I wake up in the morning. And actually, the days that I operate, I leave the house usually before my kids. And so then I don't really have any stuff going on in my head. So I'm really just very focused on that. And I prefer to have surgery days because my surgeries are quite short. They can be anywhere from 45 minutes to 2.5 hours. And so I'd like to do them on one day. So I'm sort of in a zen and a mode. And actually, the one thing that I think that medicine is kind of like is that it's almost as if you are in an active form of meditation, because you're very much in the moment. You're scrubbed. You have a team of people there to help you deliver the best result for that patient who's on the table. And there's no distraction. There's no computer. There's no one coming in and asking you for something. There's no phone that's ringing. It's very much that you are in a zone. And it's incredibly peaceful, actually, operating. So for me, it's there's a rhythm to it, and I very much enjoy it, and I know that I also feel very privileged that I have people who trust me with their faces and their eyes and their skin, because actually, like you said, it's the first thing that everybody looks at is really your eyes. It's the window to everything.
Yeah.
And of course, if you come in and you have a presence and you look beautiful in your clothes, if you don't feel comfortable in your skin, it doesn't matter.
Yeah. So you say that you work out, take a shower, go to bed. Tell me about your workout.
So I love working out, which is funny because I'm not athletic at all. So I like working out, but I'm not athletic. So I do cardio probably 5 days a week because that makes me feel better. It really
like what?
I do elliptical.
You
so
do?
I do an elliptical. Running is bad for the face and bad for the joints.
Oh, stop. Okay. So why?
So you're like, it's trauma every time you pound on the treadmill or outside, everything's going up and down your breasts, it's not it's not great for your
knees,
your joints either. So my father's an orthopedic surgeon, and he always says that the motion of the elliptical is not as
than
impactful.
The pounding. Yeah.
And I don't really like riding a bike unless I'm outside. So I don't want to go into a gym and do that. So I do the elliptical, and I can read while I exercise, which is not something you should do, but I read the Daily Mail, and it's just silly. It's okay. Yeah. It's like silly and whatever. Yeah. So I might read it for like 5-10 minutes while I'm on, but I would do that for about 45 to 50 minutes, 5 times a week. And then I do weight training, and I do that 3 times a week. And I think,
with a trainer?
With a trainer. I do it with a trainer because I have actually a lot of flexibility, and it's very easy to do things wrong and then hurt yourself.
Yeah, I was just going to say, I because I also am very flexible, I hurt myself lifting too much in the wrong way. And oh my God.
Yes.
So who knew that being flexible
was a bad thing? I know.
I was like, I was so proud. At 65, I said, you know what? It's time I learned how to do a split. And so I trained.
That's
like
amazing.
It took me a week and a half.
That's
a
it.
Little each day.
That's amazing.
You can do it. But if you're flexible, you can do it. But then weight training turned out to be more difficult because of that. And I had no idea. But so when you do weight training, have you always done weight training? So
I've been doing it for the last 14 years, mainly because I don't like weight training. It's not something that gives me, excitement.
Right.
I have a lovely trainer, and he's now a friend. And so I enjoy that time because it's, again, a moment of pause out of my crazy busy schedule, but I don't gravitate towards weightlifting. But I do it because, one, it's important. Number two, because of my work, I'm constantly sort of like hunched over people, and I don't want to be, a hunched little old lady. So and I also don't want to break my hips and my bones, and I want to have good bone density when I get older. And so I just want to be able to do normal things as I age. And I think more and more I'm getting more into it. I read this book by Peter Attia. Do you know him?
Yeah, I read it. Yeah.
Oh, So, if you want to, it makes sense if you want to be doing things, when you're
Lift
90,
baby
you need to, yes. I mean, I can't do crazy amounts of weight, but I think for me, it's a way to maintain my muscle mass, hopefully improve my bone density, and just keep me, able to do all the things I want to do as I get older.
Yeah, I agree. What about yoga or anything like that?
So I love Pilates. Yoga is I've hurt myself because, again, being flexible. Sometimes, you do the wrong thing because you can.
Yeah. I know.
It's not and you don't even feel it then. And then later you're like, oh my God, what did I do?
That's why I asked you, because I love yoga. I love the way it looks, but I cheat.
We're cheaters. I'm a cheater too.
People say, "Oh, you do that?" So I was like, "No, I was actually cheating. I know I didn't do it properly, but I love the feeling of it when your body can do things that maybe you shouldn't be doing, but that you can take yourself to a new place with working out. And I think it also has a mental kind of benefit too, because then you can do more than what you do, and we're capable of doing things. So the creams and the products even have so much more value because you have sort of this mentality and this. Even your lifestyle is understanding that skin needs to be treated a certain way, and also sweats and does all of this great stuff. So tell me about the last cream you just did. I have to say, I've made creams myself, and I did them originally through the years, mostly because I'm a big olive oil person. And I just wanted simple. My mother used just a simple cream her whole life. She never washed her face. She only took, water and this Pond's cold cream.
I remember Pond's. My mom used Pond's too.
Right.
So did my grandmother.
And my mother's skin looked amazing. And I thought, oh, maybe something simple. So I have an understanding of creams and all of that. And I don't do them anymore because I've wandered off into AI and other things. But I try things all the time. And with my exploration now, I'm really thinking hard about my skin. And if I do something, is my skin too thin? Is it too,
No, you've
not
got
have
beautiful
elasticity? Skin. But the cream, from the minute I just tried it on my hands first, and I thought, wow, what the heck is this? This is amazing. And then, and part of it also was the ritual of feeling something that's sensual, and the smell, the texture, everything was just amazing. But I put it on before I went to bed, and I woke up in the middle of the night and I felt my skin, and I was like, oh my God, this feels really amazing. And then in the morning, I thought, I really love this. So then I brought it to work because we have all ages and a lot of young girls. And I said, check out this cream. What do you think? And so it was like, what is this? Where did you get it? Everybody was like, where's it from? And I thought, I know my group. I know my team. I know when people are just, okay, she wants us to try whatever. But they were like lingering around it. And so I'm telling you this because it rarely happens that
makes
kind
me
of
so
reaction.
happy.
So what's the secret? What did you, not to give away the secret, but what were you trying to achieve, and what do you think the result is?
So when I created MZ Skin, I really wanted to create something that was simple, because actually I can't do like a 16-step routine. I needed it to be simple so I could keep consistent. So consistency in anything is key. So if it's too hard or too complicated, you're just not going to do it. I also wanted it to be packed with, like, I'm very about pro-aging. So I use a lot of, growth factors, stem cells, placenta, bioidentical, it's collagen. And I use all of that because those are all like the building blocks. So they're all like signaling messages to your skin to soup up its own ability to create collagen, create more even skin. So, lines and wrinkles are not, they're beautiful. That's life. That's your life, etched in your face. And of course, you don't want to have deep ones that, like people don't want to be, super lined, but the lines are actually beautiful. What makes skin look aged is actually skin tone and texture. And so if you have had a lot of sun damage, or you have had a lot of acne when you were younger, and you have scars, or you have rosacea and your skin is red, if your skin tone is not clear, then you automatically are judged differently. And people judge you and might even say you might have acne and be like, oh, she eats like terrible. That has nothing to do with it, but people make judgment, just based on how they see you. And that's why foundation is so powerful, because it just literally covers everything up. But I wanted you to have beautiful, no makeup look with just your skincare. And so it's very targeted. There is a pro-aging, sort of range, and that is souped up with all the stem cells and the growth factors. And then I have a calm range for more sensitive type skin that really need the nourishment to improve their skin barrier. And then I have the brightening, which has some of the actives in it, because for me, like I said, it started with the pigmentation. And so it's always about maintaining that even skin tone. And so for me, I wanted it to be very concise, simple philosophy. Throw it in a luggage, so it's less than 100 mLs. You don't need to check it in. You don't need to have too many different products. And I wanted you to feel good. I wanted you to have the joy of science. And so I wanted you to feel like, oh, this is something nice that I'm doing for myself, so that you're giving yourself that 2 minutes of massage and self-care. And all of them have clinical trials, because for me, I mean, if I want a nice cream, there's a million nice creams. I want to make sure what I'm using works.
Yeah.
And so it's going to do what it says it does. Like I said, you can do lots of things in the office, but if you don't have good skincare, then, it's kind of like having a trainer once and saying, where's my muscle?
Yeah, no, absolutely. I've been thinking more and more about that. And that's why I've been trying so many things. And if this was the only cream that I tried right now, I wouldn't even talk about it because I wouldn't know what I was comparing it to. But I've been trying a lot. And there's a lot of interest and conversation, obviously, about stem cell. And so what are your thoughts about where stem cell is going and what the possibilities are?
I think the possibilities are huge.
Yeah.
I mean, stem cell is basically like the mothership, and it sends signals to everyone, like all the different cells on what to do. So the stem cell itself is not so important. It's all the signals that it sends to everything. And so I think in the next, few decades, we're really going to see it, not just, in skincare, of course, but in health in general. And that's why, when my kids were born, I actually saved the umbilical cord blood. I hope I never need to use them. But those are all things for the future, potentially. And I think there's a huge potential there. The problem right now is knowing, with stem cells particularly, are you just, optimizing the good, or is there some bad that creep in and you might be optimizing the bad too? So that's why I think it's a little bit slower and it's going to take a lot more time, and it's nuanced. You don't want to even test that on somebody with the possibility you're going to make them potentially worse. So I think there's a lot in the forefront for stem cells and in the future.
I'm fascinated by it. I interviewed a incredible woman who is part of the University of Texas doing early on leading on stem cell research, and ultimately she has twins that are 3 years each, and her dream is that they are once a year they get an infusion of their healthy stem cells, and that we prevent
all the disease,
all of it going forward, which is the ultimate dream if you think about it. But I'm very, in my research also, anything that sounds like the most promising has stem cells connected to it. Is there any thought at all in surgery and stem cells, like when you're doing what you're doing?
Yeah. So, even early on, using platelet-rich plasma, like PRP.
Right.
So a lot of orthopedic surgeons were using that, in the 70s and 80s, an adjunct with, joint replacements, because that's harnessing your own body's ability.
Mm-hmm.
Now with facelifts, there's many people who do nano fat, which is a huge source of stem cells. Fat has lots of great stem cells in it, and so a lot of people use that in the rejuvenation world as well. And then now, there are places around the world that people go to and have sheep stem cells injected, and I'm not there yet. So, but I'm a little bit more mainstream in the sense that I want to know that what I'm doing has had some tried and tested sort of situation going on. But I think all of those things, that is where the future is going, and it might not be now, but definitely something for the future.
Yeah, no, I've been researching everything, and the sheep did come up, and rabbit also. So it's a little stranger to kind of wrap your head around it. But it is opening doors that haven't been opened before, and I just think having a little bit more oversee or something to kind of guide people properly. But it's good that we're talking about these advances. I'm just curious. I'm not a fanatic astrology curious person, but there are certain times when I speak to people, I'm wondering what is this person made up of? So I've asked you lots of questions, but what sign are you?
I'm Cancer, July 5th.
I knew
Did
it.
You knew that?
I'm a Cancer.
Are you?
I knew it. I was feeling it.
How funny.
That's why I asked you. I'm June 27th.
Oh my God.
So yes, there you go. Yes, you have the there's something in there that's saying, this girl sounds too much like. So that's very interesting. And you have kids?
I have 2 kids. I have a 16-year-old son, Casper, and my daughter is 14, Lily.
Oh, so you have teens.
I don't know what they are. They're out of body experience right now.
It's an interesting, yeah, to watch and see what's happening. One of the things I think it is really great is I'm finding the 20s, the early 20s, bringing a lot of new talent and a different mindset with young people. We have a lot of people in the company that come in at that age and different levels, and they're so smart. And it's the same kind of generation that your kids are in. And I think, we all go through crazy stuff during that period. I mean, how could you not with your hormones all over the place? But I'm really very optimistic about them. I think that they're wise. They have a wisdom that is very different from anything I've seen. And I've been doing my work for 58 years.
That's
so
amazing.
I've seen a lot of that. Yeah.
I that's good. That's really promising to hear, because sometimes I wonder if, they're not able to focus because life is in short spurts now for them. Information comes in very short spurts, and they're not as skeptical necessarily to know whether or not what they're hearing is correct, or maybe because my kids are a little bit younger. I mean, I do worry for them because you can be so influenced with social media. And, for instance, I was a teenager and I was very insecure about how I looked, but I wasn't that bothered by it because I only had a small peer group to focus on. I didn't know what people in New York City were doing when I lived in Baltimore. I didn't know, what was happening in Los Angeles.
Right.
I only saw what I saw. But they see everything. Yeah. So that gives them a lot of perspective, but then also, it also can make them feel a little bit more insecure. My daughter's like, oh, mommy, why don't I have straight hair like you? I said, you do. You're just, going through puberty. You have the most amazing, beautiful, thick mane. I mean, you have the best hair ever. She's like, no, but it doesn't look like that. And I said, but yours is more beautiful than that. So it's very difficult.
It's the beauty is in the individuality, and that's what we never know. I mean, I grew up in an Irish Catholic neighborhood, and we were, I'm Lebanese, so we have noses. That's what happens. And so I would sleep on my nose so it would turn up. And it's like, that's what we go through. That's part of everybody else is prettier and smarter and whatever, but they are really wiser because of all of this too. It's they have to be prepared for the future. So what do they say about what you do?
So the cutest thing was when my son was a little bit younger, and he came home and he was crying one day, and I was like, Casper, what's the matter? He said, I got into a fight at school. And I said, why? And he said, because my friends told me that you put plastic in people's faces. And I was like, what, Casper? He said, but you're a plastic surgeon. I said, no, that's not what a plastic surgeon does. And I said, I'm a facial plastic. Anyway, it was so cute.
That is the best.
It was adorable. I don't think they really know exactly what I do, but I mean, they do. My daughter definitely does. And my son now, I think I might have a little bit of cool factor. Sometimes his friends, his classmates come and shadow me, or they do like a little internship with me, and I don't know. I feel happy being able to do that.
Oh,
but,
absolutely.
So he doesn't say much to me, but he says, "I know you work really hard, Mommy. I know you work really hard." But
I love that, plastic surgeon. So I do have a question about AI. I'm obsessed with it. And in your world, AI is, in medicine and anything about health. And so how do you see it kind of blending in with what you do, or amplifying, helping?
So many beautiful things are going to happen with AI that are already happening. Well, first of all, I think being able to triage some things especially for people who are in areas that don't have readily accessible healthcare, it's huge.
Yeah.
I think it'll take the burden off of this big industry that is just so expensive and so, weighing so many people down. So I think that's huge just in terms of triaging. It can be bad in some things, but it can be good in many other things. It just needs to be tweaked. I think also it makes things more collaborative. And so if you have the best specialist in, I don't know, one place, you can be in another place and you can still have that collaboration, a better version of that collaboration than you could have, say, 10, 15 years ago. A surgeon might even be in the operating room, even if they're not the hands that are doing the surgery. And I think that's also really important. I have a good friend of mine who created a situation where she taught doctors how to operate virtually so that they could then go and be able to operate. So there's just so many applications.
That's great.
Then you have AI that's compiling so many different people's surgeries to find out what are the best techniques and where are the complications happening and why, to help prevent future complications. Or, you have new equipment and machinery that are able to do some of the bits. And that's just through the manipulation through, different AI. Even with skincare, I mean, we're going back to it, but we had an AI application for that where you could scan your face. It was a rudimentary version because it was just done with, an old iPhone back then. But to say, where are your problem areas? Maybe one person thinks that their problem is this, but in actuality, if they fix the other thing, they would be much better off. Yeah. So I think in that sense, it's really nice. And even with plastic surgery, you can use different ways to show what you'll look like after you've had the surgery, which again, is very nice and comforting to the person who's having it. So there's so many different applications that I think that are going to happen, even in terms of injecting certain medications. You may end up having like a little pellet and it just, it's already done for you. You don't even have to think about it.
Yeah.
So many people are non-compliant with,
it's so
regimens.
Great. Yeah. I think medicine is probably going to change so dramatically and be possibly affordable for everyone.
I hope so.
Wouldn't that be an amazing thing?
That would be really amazing.
Well, I am so happy that I got to meet you. And I'm so happy that it got me to check out your cream. I thought, I hope I like this.
I'm so thrilled that you do.
No, I'm absolutely, I know you're going to do amazing with it.
Thank you.
We have to keep in touch.
Absolutely.
My exploration of the what to do at 80. Do I make a big change? Do I do a little at a time? It's been fascinating. I've met a lot of people, taken me into a lot of areas, and I'm so glad that you're a part of it, even though it wasn't kind of the intention. But I love that I had this time with you because it sort of put me on a track that I was intending on going on, but I wasn't sure if it was right. So thank you very much.
Thank you. Thank you so much for having me.
Well, it's great.
Thank you. Thank you. I'm going to give you a hug.
So much.